Well, good evening, everybody. Thank you for joining our webinar to hear about the impact of COVID-19 and the housing market. Pattern for Progress is pleased to be working with Hudson River Housing to help facilitate this discussion. We'll be focusing on the challenges of rural housing in today's unbelievable times in terms of health, the economy, and social discord and unrest. 2020 has been quite a year. Before we begin, I'd like to thank our sponsors, NeighborWorks America, Berkshire Taconic Foundation, Mass Design Group, and the members of the Tri-Town Coalition Steering Committee. This would not be possible without their commitment and their support. So a few months ago, Elizabeth from Hudson River Housing asked if I would be interested in presenting and facilitating a webinar on rural housing. I jumped at the chance. This is a foundational webinar, and we're laying the groundwork for a broad discussion and hope to do more in the future that will dig deeper into certain topics. A little housekeeping. I have two roles today. One is to frame the conversation with data and current events. The other is to facilitate a conversation with two other panelists, Patricia Grewitz from NeighborWorks America and Sarah Cucker from Mass Design Group. We will, and I messed that up. I apologize, both Patricia and Sarah. My notes were upside down. The joys of living in Zoom, correct? Patricia is actually from Mass Design. This is embarrassing, but that's okay. Nobody can yell at me at this point. And Sarah is from NeighborWorks. We're also going to be hearing about housing challenges directly from a local resident, Joshua Schultz, at the end of our presentations. So after the presentations, we'll open up the virtual floor for questions. We have a lot of people on the webinar, so we'll do our best to try to get to all of the questions. Please remember to grab coffee and Danish at your leisure on the way out. Again, my name is Joe Chaika. I am the Senior Vice President with Pattern and the Executive Director with the Center for Housing Solutions and Community Initiatives. As many of you know, Pattern for Progress has had a focus on housing for many years. In fact, we created the Center for Housing Solutions 8 years ago to ensure we keep housing on the front burner. Pattern facilitates, convenes, and conducts presentations like this all the time. But typically we don't mess up the names of our guests. Pattern also produces local, county, and regional studies, reports, action plans, draft policy, and we also make recommendations. And of course, we conduct a lot of research and data analysis. Our ultimate goal is to provide strategies and solutions with a balanced approach to these issues and challenges faced within our communities in the Hudson Valley. I have a lot to get through tonight, so I'm going to give the speed reading version of my presentation. So sit back and watch the show. I hope you find it valuable. Our world has drastically changed since March, only 7 months ago, and it will continue to evolve into a new normal. I've been working in community development and housing for just over 30 years. I've been involved with revitalizing communities after minor and major recessions, natural disasters, and a housing bubble that burst, which left thousands of families here in the Hudson Valley losing their homes to foreclosure. Today, we're facing incredible devastation in terms of our health, housing, education, employment, and the economy. The impact of COVID-19 touches every aspect of our lives. We have now surpassed 200,000 deaths, and we will see much more tragedy and loss. Reopening of the economy is going well, and as it could be, well, we hope it's going to be a fast recovery. It'll likely be slow. Typically in my presentations, I provide slide after slide of numbers and data analysis. Things are changing so rapidly during this pandemic, and the supply of real-time local economic data is quite limited. I will, however, provide you with the most recent housing data And I'll speak in terms of qualitative data based on local observations of the economy, the market, and social changes in the Hudson Valley. So here's what we know. Main streets and downtowns, they're starting to get busier every day. Home improvement centers have been busy as many folks are working on their home improvement projects. There's a noticeable increase in traffic on the roads and pedestrians on the sidewalks. The supply chain for home improvement and food is still impacting what we see on the shelves. There is still a lot of fear of getting sick. Some people do not want to leave their homes. And for many of us who are still employed, working from home is now commonplace. School has been an enormous challenge. There are many issues and barriers for teachers, students, and parents. The pandemic forces us into a new education model of long distance and remote learning. This has proved to be very difficult for many families. They simply do not have access to broadband, technology, or even space inside their home, albeit a rental apartment or a house. Kids and parents are sharing computers and electronic devices for school and for work. The term essential worker has become well known. They're vital to our economy and certainly our health and well-being. Many people now have a clear understanding about the people we count on every day, our essential workers. Perhaps there is a bit of a silver lining here. The essential workers, most of whom are not making a living wage, are now top of mind for many people who never recognized these folks before the pandemic. Let's just hope all of them remain top of mind as we look to solve the housing crisis and the vast majority of essential workers face every single day. With all that said, in terms of the economy, I believe there's a pent-up demand for goods and for services. The economic engine is ready to go, but restarting the engine has been difficult and will take some time. Although the economy has taken a heck of a punch, and as a result, local, county, and state budgets will be greatly impacted for many years, unless, of course, there is federal assistance and federal aid. All levels of government have seen an increase in the cost of services and programs, while revenues have plummeted. The state is facing an estimated $15 billion budget gap. The immediate impact of the lost revenue, well, it means furloughs, elimination of vacant positions, services and program cuts, and layoffs. Long-term implication, lost revenues need to be made up. So how does the government do that? Well, they could borrow more money, they could raise fees, sell land and buildings, and increase taxes. Ever since the tax cap was instituted here in New York State some 8 years ago, taxing jurisdictions like villages and towns, counties, school districts, well, they've seldom overrode the tax cap. This, unfortunately, may just simply be not a choice over the next few years. I'm asked a lot of questions about housing, economic development, and the real estate market, and what will recovery actually look like? Well, there are two ways to look at today's state of affairs, as a pessimist or as an optimist. Funny thing about pessimists, they usually say, everything's terrible, it can't get any worse. But an optimist will say, oh, yes, it can. With that said, we must look for silver linings and solutions to today's challenges. Things are rapidly changing in today's world. We're in a pandemic. We have an open seat on the Supreme Court. And we are facing civil unrest. And we are in an election year, probably the most important election of our lifetime. Lots to think about. In terms of the Hudson Valley economy, our region, especially north of Westchester and Rockland County, relies heavily on tourism, the tourism industry and its related businesses, in retail, entertainment, accommodations, and dining. While these sectors employ lots of people, at least they did, The industry does not offer what is called a living wage rate. Annual wages, annual average wages in tourism and the hospitality sector range from about $21,000 to about $30,000. They're often part-time and typically with no benefits. Another large employer sector here in the Valley is warehouse and distribution industry. Wages are a little better than the tourism sector, but still not a living wage rate. A little more on that later. Yes, there are expectations, but overall, the workforce is struggling to survive in the Hudson Valley. A vast majority of the higher paying manufacturing jobs are no longer a mainstay here in the Hudson Valley. However, there are some signs in this sector of growth, again, as businesses pivot and realign with the needs and demands of the economy. From the perspective of economic development, there have been some businesses relocating from New York City to the Hudson Valley. Many are bringing higher wages in finance, accounting, and other management positions. However, the traditional business model and office space demands have changed, and a paradigm shift is afoot. Let's talk about the housing market. Before COVID-19, the real estate market in 2020 started out very strong. The lower and middle end of the market had strong sales and modest gains. We were in a seller's market. The SALT cap hurt a lot of homeowners as deductions were limited, but they eventually got priced into the market. The interest rate for a 30-year loan was about 3.5%, and the unemployment rate was hovering around 4%. The real estate industry and the market drastically changed over the last 7 months. The industry was shut down and had to go virtual, basically no in-person showings. Real estate closings took on a new look. There were e-signatures, e-docs, and drive-through closings literally under tents. Many sellers and buyers were nervous to have people in their homes, and getting repairs and improvements done was yet another challenge as construction was deemed as non-essential. It was difficult to obtain local records as municipal offices were closed to the public. Unemployment started to skyrocket and businesses shut down. A nervous market at the beginning. Nobody knew what to think or what to do. However, for those who were looking for a home and lucky enough to keep their jobs, were still in the market. Demand was high and we had a very limited supply. People started buying homes sight unseen. These were primarily people from New York City, as many people wanted to leave this highly dense urban center and move to the suburbs. Banks were reporting a healthy stream of refis and now seeing a healthy stream of new mortgage loan applications. Just when we thought interest rates couldn't go any lower, they actually did. Let's take a look at some data for the more rural counties in the Hudson Valley. These figures represent year-over-year numbers for the month of August 2019 versus 2020. Literally, these numbers were just released this morning. As you can see, there is an enormous spike in the median sales price. Sullivan jumped by over 63%, and Columbia jumped about 40%. Putting it into perspective of the housing boom, the data is not on the slide, but it's worth going over. Columbia County is actually 107,000 more than the 2007 median. Dutchess is the same as 2006, but Greene and Sullivan have jumped for over $40,000 since the housing boom, and Ulster is $37,000 over. Other data points to examine are the number of homes for sale in the month's supply, essentially the inventory. Clearly, you can see the dramatic decline in the number of homes for sale, and subsequent the month's supply also drops. This data also points to strengthening sellers' market. Sellers are seeing multiple offers, cash offers, and offers well above asking price. Appraisals and values have not caught up to the volume yet. Cash buyers are actually not subject to an appraisal as they are not getting a mortgage. Time will tell on future value. Low inventory, low interest rate, fear of dense urban environments, and remote work capabilities are all feeding this frenzy. The concern, how long will it last? What are the implications to local buyers? Will this new housing bubble burst? Overall, too early to talk long range as the market is too much in a state of flux. Regardless of the trend, it has only been a few months. Winter is coming and typically the market slows. The pent-up demand from the spring and summer is now hitting the books as deals are closing. The fear of dense urban centers is still very real. Interest rates are still at 3% and not likely to move much. Other contributing factors to think about in terms of the real estate market and how the Hudson Valley is changing. Let's think about millennials. They're now in their early to late 30s and don't want to live in an apartment anymore. Many got married, and some may want to start a family and buy a home. The biggest issue is supply and down payment. And one other thing, closing costs. It costs thousands of dollars to get into your first home. There's been a shift in dramatic increase in working remotely. How does this play into the formula? Well, the traditional 9-to-5 office model is gone. Just like on this Zoom forum, we all get to see everyone's living rooms, our kitchens, our makeshift home offices. Although it is a huge cultural shift and there are certainly challenges, it is working for many professionals, but not for all. The size of homes has drastically changed over the last 50, 60, 70 years. Homes were small, maybe 1,200 square feet back in the 1950s. Then we went big, all the way to the McMansions, 3,000 square feet or more. The demand for large McMansions has declined due to costs, taxes, and the fact that people were simply not having kids. So we started to go small again. Tiny homes, 250 square feet, 400 square feet. Now we are looking at going big again. Why? Remote work, home offices, remote learning, homeschooling, the fear of being in a crowd, home gyms and media rooms. What does this mean? Existing homes will need additions. Good for the construction industry, architects, designers. Seasonal homes are becoming year-round homes. Office parks are actually emptying out. That gives one good option of adaptive reuse, potentially for housing. Will towns allow ADUs? And what are the implications for short-term rentals as the density of hotels remains a fear for many travelers? How will remote work change our lives? No commute or a reduced number of days commuting? This will either increase work time or increase family and volunteer time. This may benefit communities looking for volunteers to sit on planning boards, zoning boards, school boards, municipal boards, fire departments. What does the rural landscape look like with all these changes and this apparent trend of New York City moving north? I want to share quickly some data on housing costs. Housing is said to be affordable when you pay no more than 30% of your gross income towards housing. Over 30%, you're considered cost burdened. Over 50%, you're considered severely cost burdened. Here are the numbers for our 5 mid-Hudson counties. As you can see, there are thousands of owners and renters paying over 50% of the gross income for shelter. Are we in a crisis? I think so. Another set of data to show the need for affordable housing is something called out of reach. This data set essentially shows the median renter wage rates, the fair market rents, and what the gap is for renters. Are we in a crisis? Again, I think so. There's a lot of red on that screen. I've been an advocate for affordable housing for over 3 decades, and I completely understand there's an affordable housing crisis, and it will only be magnified because of this pandemic. The United Way every other year, produces a study called ALICE. It stands for Asset Limited, Income Constrained, Employed. ALICE represents a household that is above poverty, but they still struggle to make ends meet. It provides strong data to help show the need for affordable housing. As you can see from this slide, the 5 counties have all shown an increase in the percentage of ALICE households. So again, are we in a crisis? Again, I think so. In terms of the rental housing market, the moratorium on evictions has recently been extended by an order of the CDC. While this provides immediate relief for renters, unfortunately, the rent will come due, along with all of their arrears. This has become an issue for both small and large landlords, as well as the renter. These landlords, they may ultimately need to make some very difficult decisions. Property owners could very easily lose up to 40 or 50% of their revenues. This puts them at serious risk of not paying their bills, their mortgage, taxes, insurance. Additionally, maintenance could suffer. Owners of commercial properties have also had to carry the maintenance and operating expenses associated with their buildings, and just like the residential tenants, the rent will come due for the commercial tenants as well. New York State just extended the moratorium on commercial evictions to October 20th. So it's a double-edged sword. The loss of rental income may it could ultimately lead to disinvestment and loss of property value. New York State has actually created a New York Forward Loan Program to assist the small landlords with their financial issues. I believe Hudson River Housing is involved with that program. There's also a multitude of other assistance programs for renters. The bottom line, no one really knows what will happen, and I offer my thoughts and analysis to frame a starting point for a balanced conversation about housing as we continue to reopen the economy and look to recover. The road ahead, well, let's just say it will be bumpy, but we are resilient. The key to normalizing the economy, at least one key, is getting people safely back to work and raising consumer and employee confidence levels. It is really important to be very cautious and mitigate displacement as home prices rise. So, what does the rural landscape look like with all these changes? Will the push from New York City to the Hudson Valley actually become a trend, a long-standing trend? How does the rural area participate in the new economy without broadband and improved and expanded water and sewer infrastructure? How does the rural area provide rental housing for essential workers? How do we deal with large lot zoning and the lack of affordable housing? Well, we have 2 great panelists to start the conversation. I'd like to first introduce Sarah Cucker, Director of Rural Initiatives at NeighborWorks America. Sarah will provide a 50,000-foot perspective on what rural communities are confronting based on NeighborWorks America's national perspective. Welcome, Sarah. Please tell us a little bit about yourself and then share your thoughts from the perspective of the intersections of housing and other sectors of the economy, access to healthcare, and public spaces. Sarah?
Thank you, Joe. Thanks so much for having me. I'm really looking forward to just sharing this perspective from NeighborWorks. My name is Sarah Cucker, and as Joe said, I am the Director of the Rural Initiative at NeighborWorks America. I sit outside Washington, D.C., and I have worked in the community and economic development fields for about 20 plus years in the local sector and private sector, and here at NeighborWorks, a nonprofit. Just to give you a little bit of sort of insight for those of you who might not know NeighborWorks or be familiar with us, We are a national intermediary, so we work on a national scale, national level, and have members, so member organizations, I think around in the 240s right now, somewhere around 241. And of those, about 117 members are in our rural initiative. And those are groups who work primarily in rural space. The majority of their work is in rural communities across the country. So that's just a little bit about NeighborWorks. These organizations really are, they're community development corporations working really primarily in the housing space. But that's changing so much. And I think as we're going to get to is some of Joe's questions here of just, it's so much more than housing. So I do look forward to, sort of talking about some of these bigger issues. I know Joe has some questions, and I'll let him go ahead and start with those.
Thanks, Sarah. So how has COVID changed the relationships that you're dealing with throughout the country?
Sure. So the relationships that NeighborWorks works in, as I said, it has been housing. And we look at housing within the context of comprehensive community development. And NeighborWorks really is looking to create communities of opportunity and strong and resilient communities. And it is that lens of a comprehensive community development. Housing is one critical piece within that context that helps us view our work. So COVID has really lifted up many of the other pieces beyond housing, so where we can say, oh wow, there's education, there's childcare, there's economic development, all these different pieces, these elements that make up strong, resilient communities of opportunity. And so COVID has really allowed us to further deepen those intersections and those partnerships. It has really allowed us to look and say, how does labor and workforce development within a small community or rural community of any size, how does that look now? It looks very different. And even a little bit pre-COVID, it was starting to look a little different because of broadband, as you mentioned, Joe. I know we'll get into that into more depth too. But it's no longer just attracting a manufacturing facility to a community. It's not a one company town. That's not economic development really anymore. And so COVID has made us say, wow, a lot of people are working at home. So we have telework, we have remote schooling, we have remote health. So health delivery looks different. Our healthy communities, we have isolation, we have mental health, rural hospitals and telemedicine. It has all been impacted severely, as many of you probably know. And I think I can safely say this is the first time in my career, and probably many of yours, where these issues in community and economic development are truly at the tips of the tongues of everyone around the country. Never did I think I would see the issues that I work on passionately in my career in the front pages of the paper, and people on the street being aware of people. They know what broadband is, or telemedicine, or workforce training, because it is being talked about and it has been laid bare by COVID. But these are really areas where I think that the partnerships, COVID has just elevated what was there, but now has really created the need for the strong partnerships.
Sure. Sarah, so, I brought up a lot of data and some trends here in the Hudson Valley. What are your experiences and what are you hearing from other parts of the country in terms of what can we expect from the impacts? Are they similar to what we're seeing here, or are they a little bit different? Here in the Hudson Valley, we're very close to New York City. Within an hour, you're in the neighborhood of 8.6 million people. Yeah. But not all of the country is like that. And what we call rural here isn't exactly rural in Nebraska or Iowa or South Dakota. So could you talk to that a little bit?
Sure. And so I'll preface that with a bit of, so NeighborWorks, we are split into 4 regions. So there is a sort of a national oversight, but we are split into a Northeast region, a Midwest, a South, and a West. And so we have really worked very diligently and intentionally on having a clear communication between those member organizations and our leaders that are working in those regions, and then us at the national level, and so that we're working together to understand those issues. And in fact, I just got off a call recently with some folks in the Northeast and sort of mine some of those issues that are facing you. And I will say that just recently also in the Washington Post, there were several articles about many of the issues that you mentioned. I think Kingston was brought up and Woodstock were brought up, some of those communities as really facing some dramatic changes due to COVID. What we are seeing throughout the country is we're seeing struggling across all of the regions. What we're hearing in the Northeast and in the Midwest, we're hearing most acutely housing prices increasing, like you said, some urban flight. We're hearing food insecurity, definitely across parts of the Northeast. We heard that. We are hearing childcare as being a really major roadblock to bringing people into a more normalized work environment, as you mentioned, Joe. And, I think those issues cannot be really understated enough, overstated enough. Mm-hmm. But they are ones that so many organizations, like our organization, where our groups on the ground, we're not always working in food distribution, food security, and childcare. But it is something that because of COVID, because of those issues, that we have now found new partners, and we're realizing new partners and new ways of sort of helping knit that social safety net that has been so critical. We are hearing virtual education, broadband accessibility continuing to be an issue in all regions. Some areas within one region have great broadband, while others really struggle. We are hearing also that workforce housing and training is critical. Very large demand for workforce housing across all of the regions. Farm labor housing is also in demand across many rural areas. This also goes along with some of these areas where there's farm labor housing, there's workforce housing. There's also many small businesses who've taken advantage of these CARES loans. And some of the CARES loans they're going to be expected to pay back, especially in the South. In the southern region, we heard a real concern for organizations who took the loans out. How are they going to be paying those back? They need those to just be operating. So those are some of the really critical issues that we've heard across all of the areas, but it really points to the need for continuing partnerships, definitely.
For sure. One thing that we're doing here in the Hudson Valley is every other week we convene a group of economic development specialists, a separate group of workforce development specialists. Mm-hmm. And the conversation finally, after years and years of pushing, is pulling the synergies of housing and those two groups together. Mm-hmm. Unfortunately, it takes some awful times to see those connections, but it is occurring. So it sounded like to me that you're seeing that in other parts of the country as well. Absolutely.
Comprehensive community development is really a model that's working right now to understand all of the different impacts.
Are there any other ways that the rural community in particular might leverage some of these community changes? Could you address that a little bit?
Sure. I think I sort of have a few thoughts on that. First, I think capitalizing on new sources of funding coming from philanthropy. And why I say that is because another thing that I heard across our regions and from the member organizations is many are saying, wow, people are coming to us for the first time, or they've remembered us again, and they're wanting to, now that these issues are elevated, they're really wanting to put their money into our space. And we've heard some great examples, and some very close to you in the Northeast, of how they can really use those new sources of funding who are coming to them and pass those benefits along to their clients in their communities, whether it's converting loans to grants. So some of our organizations who are CDFIs or who are micro lenders are able to convert some of those to grants. converting restricted loans to unrestricted loans. So I think that's one way that we might not necessarily think of first, but how can we really use those new sources of funding coming that wisely? So while the door is open, let's put our foot in the door a little bit and let's think about how we keep that door open, or we open it further than it has been open before it gets a chance to shut. I would say increasing partnerships, as I mentioned before, is that we are just really seeing this across the country, that due to the differing needs that our organizations have faced, they are finding new partners in their communities in order to serve their clients. And that has really jolted some who, just because of the time and because of nature, we're sort of really working in one area specifically. It's really sort of forced folks by necessity into service in a very real-time interdependent model. And I think that those partnerships will definitely benefit and last the organizations within their communities as this pandemic continues to sort of move along and evolve, and as the economic situation continues to evolve. Those partnerships can only benefit as things move on. I would say that, when some people think of the tax base, wow, there's a lot of new people moving into our communities, and can that improve our tax base? I think when I think of a base term, I know any urban or regional planners out there might know about cost of community studies, and the idea that I'm always sort of hesitant to think about great benefits to our tax base when it's all in residential growth, because there is a cost of community service burden with that. For the houses that come, as you all know so acutely in your communities, there is schooling, there's community services, there are libraries, or all those pieces. It's an expensive land use, if you will, to have in your tax base. So I'm hoping, and we're really looking at how can the idea of telework and different technologically dependent industry and new industries, how can they settle in areas in some of these more rural or perhaps semi-urban or semi-suburban, sort of on the fringe. So how can they settle in some of those areas and provide some of that business tax base that doesn't demand quite services? I think lastly, in terms of really how can we leverage some of this community change and make some lemonade out of lemons of COVID, looking at partnerships and broadband. And, I worked with many communities for a couple years, specifically in rural broadband around the country. So working with communities to say, if you don't have it, here are all the different partnerships that you need to be making to start on your way towards getting broadband. So it's creating champions in those local elected officials, working closely with your regional economic development agencies, working closely with the state USDA, starting those discussions across your region, and really start building those partnerships. If you do have broadband, it's starting to say, how can you use this as an economic development and a community development tool? Is it attracting folks to work remotely? The rural areas I was working in were very small communities. Maybe some were 700 to 1,000 people in very remote areas who had broadband and were attracting people who were sort of creating some life and some new vigor to their communities, because they could work in Singapore or in Hong Kong, yet they could live in a community of 700 at the foot of a mountain. So it's really saying, how can you use that to your benefit if you have it? But those are really hopefully some pretty discrete ways of how we can go ahead and make, as I said, some lemonade out of some pretty tart lemons in 2020.
Yeah, those are great, Sarah. I love the concept of building local champions and what I'd like to call ambassadors of change. Mm-hmm. The age-old argument of, we don't want any more residential development because you're going to bring in the old formula of 2.5 kids per household, and it's always stopped process and stopped development. It's just not the case anymore. So hopefully people will start to see these things. Just one last follow-up question. Here in this part of New York State and across the country, we've seen a large influx of the community development block grant funding. Specifically, before COVID, it was called DR, disaster recovery. Now it's called CV, and those are large infusions of cash into the communities. And a lot of communities are looking at business loans. They're looking at rent relief. They're looking at buying sanitation and food. Have you seen any other really sort of best practices early on with the use of CDBG dollars?
So in the communities within the rural initiative, so the folks with whom I work, CDBG doesn't apply to many of their areas. It's really not an area that applies to the communities where I'm working, and many folks, will sometimes lament that and say there are pots of money that are available to communities that don't fit our definition, which is true. And so there has been a lot of work at the CDFI level, the Community Development Finance Institutions. And so those have been working overtime at really providing a micro lending, business lending for many of these smaller rural communities. That is where I'm hearing. In terms of the federal funds, it was really much of, it was I have already forgotten. I think PPP, the Paycheck Protection Program, right?
Yeah, a whole new set of acronyms.
That's right, at PPE and PPP. So many of our NeighborWorks organizations, a vast majority, did apply and receive their funds. Are paying them back. Some applied and decided, they said, well, our books are strong enough. We're going to leave those for someone else. We don't need them right now. We're going to be, more conservative and judicious on this. So. Yeah, CDBG is not an area that my groups get to work in much. So yeah, we do have those areas
within New York State as well. But thank you, Sarah. Those great responses. Appreciate that. I'd like to actually turn the tables over to Patricia, Senior Principal and Managing Director of Mass Design Group. Patricia comes from her home in Boston. And so welcome, Patricia. And I'd like to have you tell us a little bit about yourself in sharing your screen and your slides, and let's walk through your presentation. So welcome, Patricia.
Thank you so much. And thank you everyone for having me. Obviously I'm an architect coming from a design profession and from Boston. So I appreciate the extended welcome into this conversation, and hopefully I can add something some food for thought or add something unique to the perspective that you all are bringing into this really important conversation. So I am an architect. I'm a senior principal at Mass Design Group. Mass Design Group is a nonprofit architecture firm. We consider ourselves a design collective, and we are a mission-based organization that really partners with other organizations to see how the built environment can improve lives and promote justice and human dignity. I put our offices here because we do have an office in Poughkeepsie, New York, and they would have loved to join this call today and be the one speaking to you, but actually felt that some of the work that is coming out of our Boston office that I've been leading around affordable housing, community development, would be maybe something interesting to have here tonight. So one thing that just for way of introduction, Mass Design Group actually was founded 10 years ago, designing for hospital settings, specifically around infection control in response to epidemic diseases, the extremely drug-resistant tuberculosis that was globally a pandemic and really seen in a lot of healthcare facilities in Africa. And so we were in those hospital settings exploring how we could improve health. And in the last 5 years or so, I've really begun to work more in the US. And my work in particular has been focused around affordable housing and how we can improve health in our housing here throughout the United States. And specifically, I've been working on this one project in affordable senior housing, really focused on how seniors can age and live more productively and live better lives in community. And so this spring, as COVID-19 hit, our team was really questioning what it meant to design safe spaces. And with some of our healthcare partners, we were being asked to provide guidance on best practices for infection control, really to meet the urgent needs of our communities and specifically to healthcare providers. So this is a a piece of work that we did with the Mount Sinai Hospital, really understanding and analyzing how they could improve their spaces, really create safer interactions between patients and doctors, those that were infected with COVID-19 and those that were treating and caring for them. But at the same time, as we were having conversations about healthcare, I mean, what's interesting about COVID-19 is it transcends all typologies. And so in the affordable housing world, we were also seeing and having really meaningful conversations with our partners about this dilemma. And as we all know now, you know, COVID-19 is disproportionately affecting our elders and the senior population. But another threat to senior health is social isolation. And so, you know, the question really became, you know, how could we actually design for safe interaction and not just for social isolation? And so we started sharing, you know, our ideas and listening to our partners and others within our kind of broader housing and community development network. And we brought together these developers, brought together architects, housing operators, and funders who are all asking these same questions. We all know seniors are at greater risk. We all know that social isolation is a threat. And how do we balance infection control and social interaction? So we put those thoughts and best practices into a guideline that captures these lessons. It frames the issue, explains our methodology, as well as articulating some design principles and guidelines, and then applies them to a case study. And we identified some basic strategies that help improve infection control that are applicable across many housing situations. So fundamental principles like making spaces breathe better, or sequencing the flows through a space, encouraging people to get outdoors, or embedding technology. You can kind of read them here and see, you know, how they kind of cross through not just senior housing, but many different types of housing. And one of the things that we were really challenged by as we thought about infection control was that it's really challenging to grasp, you know, all of the different variations of housing to create one guideline. There's different, in senior housing, there's not just different housing types, there's also different care types. And so we needed to understand how we could code things as we do in healthcare as clean spaces that are very low risk, like a staff lounge, and how we could identify dirty spaces, places that maybe have a higher risk, like the patient room. How could that apply to housing? And that distinction is just more challenging when you're thinking about housing. You know, all homes, though, we learned, you know, do encompass some level of public and private realm. And for those practicing social isolation and social distancing, it is typically understood that where there are more people, where there's public areas, there's greater risk of contagion, or spaces where there are fewer people or private areas, there would be less risk. And so our team tried to understand that in a more nuanced way. So you can see that actually it's more about understanding the threshold that might be an individual's understanding or an affordable or multifamily housing. That threshold actually might be much tighter to your bedroom. Whereas in rural housing, your threshold might actually be out in the public realm. It might actually be at the end of your driveway. It might actually be at the place, you know, where you actually contact your first other individual at the store. And so that's something that we were really interested in, understanding how do these principles apply to these different types, and how can any you know, provider or operator kind of use this as a diagnostic tool to understand where their sort of threshold exists and how the principles could apply. So here are some highlights from the guide. We sort of took it through this public to private realm. You know, in the public realm, simple things like creating clear signage, designating outdoor spaces. In the semi-public realm, co-locating additional amenities like a grocery store or additional space for, say, the mailroom. We looked at additional social and lounge spaces in the kind of semi-private realm. And for simple strategies like increasing airflow or access to operable windows in a unit, or potentially even adding on a balcony. And some of the things that we learned is that, you know, this is not a one-size-fits-all situation. But the guide introduces prompts really to help residents, property managers, and visitors determine where their threshold lies and key factors to be aware of to maintain infection control. The other thing that we were finding through this work is that good design for infection control is also just better design for communities. And that often the things that we were suggesting weren't necessarily super innovative, like a balcony. But in affordable housing, that's often seen as a luxury item. It's not something that's often offered in basis of design. And so how can we use this opportunity to see how these elements, which are now clearly, distinctly linked to health outcomes, can actually be tools for advocacy for promoting better design in the affordable housing that we create. And so this is just really, this was a beginning kind of guideline and dialogue. It's open and available on our website for anyone to look at or comment on. It's constantly being updated and edited as we know more. But I wanted to share it because I think it's an interesting perspective that might be able to be applied more broadly, not just in urban communities or rural communities, but really across the spectrum of individuals now facing COVID-19 and trying to get back into a new normal, if you will.
Sure.
The other thing that I wanted to talk about, or the kind of topic, was some of the research and learnings that we have been gaining about kind of the public realm. Most of us all know well, this is an image of the Boston sort of neighborhood map on the right left. Probably all know now in the news just that communities are disproportionately affected by the pandemic. And while we know that it spreads through the air, there's lots of other things that we're constantly learning about why are certain neighborhoods disproportionately affected. And some of the trends that we're seeing in Boston, is really that, overcrowded living conditions, due to high costs of housing are actually creating more difficult situations for people to maintain best practices for infection control. We're also seeing that existing kind of higher rates of environmental toxins also map directly with health conditions and the ability to have any sort of existing health condition exacerbates your risk for COVID-19 transmission. We're also seeing higher rates of essential workers commuting to high transmission sites and back and forth, and also a reliance on public transportation to get to work and care. Another sort of bit of research that I wanted to share tonight, because I think it is relevant to your discussion, is a body of research that really is showing that urban density in particular is not necessarily linked to higher infection rates. Maybe some of you have seen this or read this, but it's interesting because, from a Boston perspective, as we're working on with some of our neighborhoods and community development and urban design guidelines, which I'll get to in a minute, there's a fear of density. And there is a fear of being in the urban center, and there are other reasons why, infection transmission might be different there. But just being in a non-dense area does not necessarily reduce your risk. The denser counties in this map and in this study, as compared to more sprawling ones, tended to have lower death rates, possibly because they maybe have, a higher access to better healthcare systems. But they also saw or started to see a correlation that higher rates of infections in counties that were related to larger context of metropolitan areas with a higher number of counties that are tightly linked together through economic, social, and commuting relationships were more vulnerable to the pandemic outbreaks. And I think you see that in some of the sort of areas outside of New York City where they have also been disproportionately or just unexpectedly affected. And so one of the communities that we are really learning with through this pandemic is here in Boston. It's a neighborhood called Mattapan. And it's a predominantly Black and Caribbean immigrant population. And before the pandemic, we were involved in creating some urban design guidelines with the city of Boston to understand the community goals that would inform the creation of policies, programs, zoning, and design guidelines, really to get ahead of future development and understand the community goals and bridging the process, or bringing the process, to the people in the neighborhood. And in Mattapan, while historically for the last 10 to 20 years, Boston has been booming in terms of development, this neighborhood in particular, even though it lies within the city limits, has seen very little of it. And while that means that, in some ways, they've benefited from, sort of being protected and being able to maintain their community cohesion and relative affordability, they haven't benefited from the development economically or to increase their public amenities. And so now, really as the development boom has sort of increased throughout Boston, the pressures for affordable places to live, as well as access to just the city and transportation, has really put Mattapan at risk for gentrification and displacement. And so we started this process by understanding kind of what exists in terms of existing zoning and guidelines, but also took a much more on the ground approach, really working with the community to understand their goals and bringing the process to them. And from that process, we created a mission statement to, support affordable housing, create opportunities for businesses to thrive, enhance connections to improve the neighborhood, and experience jobs in spaces where people gathered. But we really push in the engagement for the community, not just to settle on goals, but to really link them to outcomes. What did they want to see come out of this? What would show them that this process had been successful? And it really got into sort of a nuance around true values, not just goals for the project, but values of the community. And one of the things that we did was actually engage with the community through a series of workshops, this one in particular, which aligned their values and goals to a potential development in the future, and helped us understand how the community, both wanting affordable housing and urban parks, could gain access to those amenities through the development, but also understand the trade-offs as well as the boundaries and what they were willing to accept in terms of how that would change their community and their neighborhood. And so this is some of the takeaways that are coming in to inform our design guidelines. And we were in the midst of this process. This meeting was back in February of 2020, when we basically went from this type of an engagement and process to this one, where we're here on Zoom. And I think there are some lessons learned that we're learning actively through COVID as it relates to engaging in this kind of process. And I think it's that, one, we're learning that community engagement actually needs to be improved in general. And that this is an opportunity to think about how it's done differently and really shake it up. I think we are seeing that there are, in some cases, even with my own neighborhood association or my own neighborhood group in the city, we had more people showing up because 7 p.m. at night on a Tuesday didn't work for everybody. But being at home, being able to make dinner, be there for your kids, put your kids to bed, or even just, elderly coming out of their homes, we are starting to see an uptick in actually participation or different voices in the community participating in engagement. We also saw in another project where surveys were sent out, where the surveys were a great mechanism, and people really felt that that was an opportunity to be engaged, possibly because they're at their computer all day and looking for a distraction. But, there's other ways that we can think about community engagement and doing it well to make it more of an equitable process. Another sort of takeaway from this that we're learning is that we were concerned about some of the changes that COVID-19 would have on our study on this urban design guidelines, specifically around the economic sort of state. And one thing that we recognized is that by going through this process and understanding values and goals and outcomes, that those are the fundamental things that won't change. What might change is the method about how they're implemented, or how we implement them in the community, or how the economics could support some of those initiatives. But we could really bank on the fact that these values for the community wouldn't change, and that could really help us continue to set up guidelines that were going to be useful for the long run. And then the other thing I think we talk about through this project a lot is that, it's clear that COVID-19 has highlighted the inequity in our communities. And there's now evidence of the kind of structural racism, the structural injustice, and how the built environment is playing a role in exacerbating those conditions, and the conditions now affecting our health. So it also puts us, I think, to Sarah's point as well, it puts us in a position to advocate better for those communities and put these communities, arm them with the right tools to be able to ask and take advantage of this, to apply for the grant, which we've been able to do, and to be able to actually access some of the funding that's now being unlocked, and to see themselves really taking control of the future of their community through this pandemic. So I share that now as, I think, the end of my, sorry, this is the last slide, just sort of showing how we're evaluating some of the metrics and values and why those are so useful. So thank you.
Well, thank you, Patricia. One of the big issues that we see here in the Hudson Valley, and I'm sure it's across the country, is community engagement. And prior to the pandemic, community engagement has always been the same old thing. You throw out some surveys, you throw out some flyers, and you get the same. If you have a city of 25,000 people, you get 200 people out at an event. And if you take an attendance or a record, it's probably the same 200 people that have come to this event over the last 10, 15, 20 years. So another silver lining, if you will, is that if people do have access to a broadband with Zoom or whatever platform they're using, they are able to get their opinions across, which is terrific. So really appreciate your comments around that. You flew through every question that I could possibly think of, so I really appreciate
well.
that. So at this time, housing challenges are very real and very personal. We'd like to ask a local resident. I'm assuming he's online. I haven't seen that he's not. And I'd like to introduce Joshua Schultz to the virtual floor and to talk about some of the challenges that he's been facing. Josh, pleased to meet you.
I'm unmuted. There we go. Everyone, thank you for having me today. So what I want to do is just is to provide some context on what we have experienced here in Northeast Amenia and Pine Plains. Give you some of my perspectives on what has gone on in the housing process, the affordable housing process that we've already been engaged in. And, a lot of the questions that I already had written down had been answered, so I only have a few questions when we get to the end of that, so I guess that's a good thing. When we talk about the Hudson Valley, it's a little bit different when you get out here into the Northeast in Millerton and Pine Plains. We aren't a central transportation hub. We do have 2 state roads that come through us. We are close to Connecticut and Massachusetts, but we are very rural. For years, the predominant employer of our region was Taconic DDSO, a state facility, as well as IBM, and cuts to both of those organizations have really dramatically impacted the employment opportunities for our area. So long before COVID-19, housing was a big issue here in this area, and it only started to become addressed when those who had the time and the resources to act realized that the residents that we now know as essential workers were leaving at an alarming rate or living in substandard housing, and that comment came from my partner Kristen, so this whole organization started, and we started looking at affordable housing, and then COVID-19 hit, and it's made things quite interesting along the way. But this is from my perspective. I am fortunate. I am a white, cis, heterosexual, working class male who has the privilege of residing within a quality rental at an affordable price with a wonderful landlord. Although if I did not have this housing security, I wouldn't live here in Northeast. I couldn't afford to. But to confirm my inherent privilege, just as an anecdote, my opening point that I brought up earlier that my partner had said, she had made that exact same comment in a meeting several months prior, and it was met with silence and disregard. And so much so that they had to write in the minutes of the meeting that it was not the viewpoint of the organization. I brought that point up last week, and it was met with praise. So one of the things that I wanted to bring to the table, and everyone that's watching, is that we always need to be mindful to meaningfully engage, not just listen to the communities that are affected by this, because they're not always able to participate in these discussions due to familial and financial obligations. And as a result, they wind up disengaging. Like I said, I am fortunate, and my experiences with the housing crisis that has plagued our area has been minimal in comparison to people of color, members of the LGBTQ communities, and the impoverished due to just systemic biases, systemic racism, and all of that. The housing stock, whether rentals or ownership of homes, was limited to begin with prior, but now here we are. The surge of residents fleeing from the densely populated areas of New York City and Westchester has put an even larger strain on our housing stock. The transformation of workplace normatives to allow for more remote opportunities has amplified the permanent residency of the community that has come north. The secondary problem that has blossomed because of this is houses and rentals that were once possibly attainable by myself and the working class and those in the middle class have now become just the opposite. The rewards of cash offers, sight unseen for houses, and the high selling prices have dramatically incentivized sellers to sell. Just for instance, a very real example, a house that is assessed just up the road from me for $430,000 is now on the market for $900,000. And I suspect that they're probably going to meet somewhere in the middle, if not higher than that. There have been so many closings in the area as of late for 30 to 40% higher than the assessed values. So as a result, the housing stock has diminished even more so. And what housing stock is still available is substandard, because the landlords that lived there before, that were renting before the COVID pandemic, they keep it substandard to maximize their profits. Like any issue, the housing crisis is multifaceted. It is joined by the economic disparities that exist within our local community. There is no large employer. There are not very many sustainable career living wage jobs to be had without commuting. So I like to call Northeast a bedroom community, because not only is it a weekend home for folks that don't necessarily live here, but those of us who do usually wind up commuting half an hour to an hour. So I call it a bedroom community. And that has created a divide. There used to be large intersectionalities that occurred on Main Street, if you will, as a conceptual identifier, but more and more it has become a fence that most can only look through. I am only able myself to participate fiscally in a few businesses, and that closes off any connectivity to a large percentage of the affluent here. In general, minus a subset of the affluent, because there are definitely a bunch, that they themselves are disengaged from their communities as a whole, besides how they spend their money. So for me, I travel for food, I travel for entertainment, I travel for just about anything. We're in a food desert here. There is no local grocery store, not one that any ambulatory resident is going to be able to get to, or non-ambulatory resident is going to be able to get to. So I travel for just about everything. There is a barrier in which I cannot jump over and to engage in our community beyond the civic duties that I have undertaken. You obviously cannot talk about these housing issues without talking about all these other issues, but this is just a snapshot from my point of view of the problems that need to be fixed along with the housing in our community to thrive and serve its lower paid and most vulnerable classes, the folks that we have deemed essential workers. I myself apparently fall into that category of essential worker. So like I said, you all had kind of answered my questions beforehand, so I'll just try and strum up two right now. For Sarah, if you would please, comprehensive communities. Given what I've just kind of described, which is a very short synopsis of what's going on here in Northeast, how would you apply that model to what we have here? And to give you a population context, the village of Millerton is roughly 900 people, and we are encompassed around by the town of Northeast, which is, I think, roughly around 3,000 as of the last census data. So how would you apply the comprehensive communities model to someplace like here?
Sure. In the comprehensive community development model, it's really stressing that there are many interdependent pieces required to create those strong communities. And so it is creating those partnerships and connections between your economic development agencies, perhaps those are at the regional level or perhaps those are at the local level, with the folks who are providing social services, with education, your K through 12 and your community colleges, with your Chamber of Commerce, absolutely critical, into your mayor and your planning department and the community development department, and then working with, again, bringing in like the nonprofit sector, the housing, the community development corporations, bringing in utilities and public works. So it's basically recognizing that all of those pieces work together and are interdependent. And so when I've worked with different communities of that size of around 900, sometimes it's simpler. What I have found in some of the smallest communities is there aren't always departments of X, Y, and Z. It's simpler in that there's one person who is perhaps your public utilities director, your planning director, your engineering, and your roads and your transportation director. And so in that way, it makes it simpler. And I've also found in some of the smaller communities, my experience has been the level of innovation and the level of we're going to all band together because we are part of this community and making this happen has been the greatest. I see that in the smaller communities, finding those champions, it's been very interesting when you say, here are all the pieces that are working in your community. Not only is it bringing everyone together and to have people hear from each other, like in the community of 700, it's in rural Western Washington. And I remember being there and someone who was in charge of some private tourism ventures, someone else in the community had no idea. They said, oh my gosh, you mean you've been running things down the river of this and this and you're bringing people in? And they said, yeah. And yet they both go to the one store, their kids both go to the one school. And part of it is just bringing folks together and trying to make those connections of having people in the room, sharing the stories, what are their experiences. And so it's starting to expose that. And then it's finding the champions who know who the different who all the different players are. I've always found after digging quite a bit and working with people from all those different pieces I was talking about, those different elements, there's usually one or two in each community who has their pulse on what's going on and who is a natural connector, and really using those champions and those connectors. I think more than anything, it is the willingness to partner and to rely on all the different sectors. And that is what I think COVID has really brought up, where sometimes we are in our silos too much, or we are tunnel visioned on X, Y, or Z project, or whatever might be coming before the board of the commissioners or town council, whatever it is in your jurisdiction. And I think it's really recognizing that all those pieces are required and getting the nonprofits to the table with the Economic Development Agency, with the planning department and the mayor, with the transportation, with the utilities, so that decisions that are made for the future of these communities by whether it's councilmen, elected officials, it has all the players at the table. Too often I see, especially the nonprofit world tends to really get sort of left out. And I know organizations who've said, gosh, they just come to me after a new business has come to town or after a new venture's happened. The EDA comes and says, well, now what are we going to do? We need 20 new units of multifamily or whatever it is. Making sure that people are very invested in that local decision-making process and everyone's at the table. And I think when they all realize the value they have, getting them to the table is an easier sell. Easier. I'm not saying easy. It's just a little bit easier. So right.
Yeah,
I don't know if that answers it.
Yeah, no, that definitely does it. It's definitely a great starting point to conceptualize that while we do have a coalition that is working towards affordable housing, we definitely need to rein in the other partners and stakeholders, if you will, and other agencies that might be able to play even just the smallest role in helping build this bigger picture that we have. And so building upon that, I'm going to ask Patricia about neighborhood maps. You had mentioned that. How do you think that would play in bringing in key community engagement and key community players?
Well, I think that, community engagement in general, I think in COVID is very challenging, right? And it's challenging because I think at first we have to understand if it's the right time for community engagement to exist at all for some of these communities. I think being understanding why it's the right time to persist, and understanding really the objective and goals about why it must happen at this time. I think some of that, is just a sensitivity to what different communities are experiencing, but some of it is about are you going to actually be able to have a fruitful conversation with a community that is afraid or is speaking out of fear, right? And I think some of the other sort of, I'd say principles that we are sort of starting to look at as an organization around even conducting community engagement is also, as we're talking about, understanding the bandwidth of those that we're trying to reach, identifying collaborators. Connecting digitally is one way, but I think there's many different ways that we can connect with people, meeting them where they are, setting up some kind of like drop-in, drop-off booth, canvassing, I think is like something that we go way back with that is coming up to be much more relevant to meet people where they are. And then also I think we're trying to, use the kind of the mapping of the neighborhood, understanding the neighborhood, understand what we're seeing as trends, to get more creative and get strategic and try to be a bit more forward-looking in the kind of methods and activities and exercises that we're just starting to implement and try. So I don't know if that's exactly what your question was, but
No, you definitely answered it. The only other question that I had was what is your idea, because you spoke about affordable housing, and I saw a lot of references to like larger structures that had common hallways and stuff like that. How would you apply, what would affordable housing look like to you in a more rural context, where perhaps it's condos or whatever? What have you found has been the most predominantly effective type of affordable housing?
I mean, I think it depends on the community. The reason why I showed more multifamily housing and why that was present in our guide is because for seniors and for COVID, it's one of the most challenging. Like when you have to share an elevator in a corridor and you don't have the luxury of outdoor space or your own front door. That's why that was the case study. It's also, generally what we see more in coming out of our Boston work. But we have an office in Poughkeepsie that's been doing smaller units that is more kind of small scale developments. And also out of our Santa Fe office, some of our team members are actually developing native housing, so housing for native communities, which is very different. And I say that to say that there's not a one size fits all. I think it really depends on the community in which you're working. Where we're working in Boston, like multi-generational housing is really important. And thinking about how you actually create housing that supports intergenerational living and intergenerational living that's safe is one of the big challenges. Or how we think about, ADUs or accessory dwelling units becoming a part of a way that we can sort of increase affordability and also create some kind of ownership and wealth generation. So those are some of like the smaller scales, but I actually have a hard time saying that there's one thing that I'm interested in. I do hope that as a trend, we would see more suburban communities being more open to affordable housing and seeing it in their neighborhoods and at different scales, that as designers and as developers, we would somehow get more creative to see it outside of kind of this, platform plus, 5 stories of housing that we see in a lot of our kind of cities, which I think people react to because it doesn't fit the context of the rural or suburban communities as well.
Great.
Thanks, Joshua. I'd just like to add a little bit to that. There's a movement that's called small incremental development, and in rural areas, building 4plexes, 6plexes, 8plexes, they're not massive. They're not intrusive on a rural character of a community, and also without water and sewer infrastructure, only 4 units or 8 units could be achievable. If you have perk and all of those kinds of things, but that's another possibility. And again, to repeat what Patricia said, as far as ADUs, that's a great way of looking at affordable housing and also helping people age in place. I think that's really critical as well.
Yeah, no, I've definitely noticed that I won't call it a trend, but aging in place is very much a big consideration in people's minds when they're buying homes today. Very much so. And the only really last question that I have is for Sarah, and that's on remote work opportunities. How do you see that benefiting a local economy in general, but also how do you see that potentially helping the classes like mine, working in middle classes? How do you foresee that potentially being a benefit?
So where I have seen the remote working benefit smaller communities is in smaller communities somewhat different than yours, where they don't have people flocking to them. Their numbers are going down. They are not facing the demographic trends that Joe so aptly outlined that are quite frightening in some ways. There's a lot of folks moving quicker into your areas than really can be accommodated right now. Where I see remote working is it is providing the opportunity for people to live and build communities in rural areas that for so long in much of the country have been on decline, and they've been losing population. They've not been able to retain the youth who perhaps get trained and leave. And so it's attracting businesses, whether it's through small business incubators and workforce training opportunities with community colleges. So I've seen that in several very small towns where they're working in training, whether it's in the construction trade, the food, like catering, communal kitchen trade. It's those particular training programs. It's allowing a different new path so that folks who really do want to stay and have higher paying jobs, that they are allowed in communities with that broadband access and the remote and the training to achieve what they need to do to often stay and settle down. Because many times when the youth leave to get the higher paying jobs, it's hard to get them to come back. And I think just the ability in partnership again with, perhaps I've seen it most often with community colleges, where it is offering new avenues for workforce training and job training. And then again, it really isn't saying the only way you can make a livable wage or a working wage is to leave our community, but you can do that here. So I guess maybe that's more of a broadband answer because remote works with it. But again, seeing so many people who are choosing a slower pace of life, who are going to smaller areas or quieter areas, if you will, or seen as quieter, and they're allowed to work wherever they want to be. And I think got some inherent community benefits, is just there are folks there and present in the community. They are working, but they're not spending hours commuting. And I think that is a quality of life, or, a QOL, if you will, that is so hard to replace. And that's going to be a very interesting change as remote work. We don't know exactly if that's going to continue in the same amount, if people will commute again. I doubt people are going to be willing to commute as far again. But those are just a few of my thoughts. I don't know if that answered your question, though.
Oh, no, it definitely did. And that's it for me, but I want to thank both of you for your time.
Thank you.
As well as you, Joe, for facilitating.
Thank you, Joshua. I appreciate that. We did not get any other questions that have not been answered up in the queue. So at this point, I'd like to turn it over to Elizabeth to say some closing remarks. Elizabeth?
Hi, everyone. I just want to thank you all so much for your participation tonight. Hudson River Housing is so proud to work with all of you, and we're so thankful to Pattern for Progress for joining us and hosting this really important conversation. Thank you, Patricia and Sarah, for all of the insight that you brought from a more national perspective, and certainly Josh, your insightful comments about the ways that the pandemic has exacerbated things that we have been experiencing in this area and really brought to light new and existing challenges has been really useful. I want to thank the Berkshire Taconic Community Foundation, which provides support to the Tri-Town Coalition, which is a collaborative of nonprofit organizations and community members that care deeply about issues of affordable housing and economic development in the region. And I want to thank them for their support. I want to thank all the members of the Tri-Town Coalition Steering Committee that worked to put this together, and particularly the Northeast Community Center and Grace Church, which have guided this process for over a year now. And we are kind of getting back into community engagement. We heard so much about that this evening and how that has shifted over the past couple of months. And so we're glad that you were all able to join us tonight as we sort of dive back into these important conversations. And there will be more to come. Our town teams continue to meet, and there's information about how folks who are in the local area can get engaged in this conversation on an ongoing basis. And we hope to do more of these broader webinars as well to keep people informed and involved in the future of our communities here. So again, thank you all so much for participating. It's been a wonderful conversation, a lot of food for thought. Thank you.